And so now you want to talk about merit while we're still at the bottom. You're not performing anything that provides equity to get us back to even. Remember, Black people are about 13% of the population, but only 6% of doctors are Black. 6%. That means 94% of physicians in the United States are not Black. For all the Black Americans, especially, that have said that they think that Donald Trump is going to be good for them, Donald Trump is having a war on us. He's waging war on us, and some of us have not been paying attention. Some of us are so focused on one aspect of what he's doing and saying, oh, see, that's what we voted for. When in reality, other aspects on actually helping us out materially, he's pulling the rug from right under us. He's no different than the Democrats. Let's talk about healthcare, Black folks. Let's talk about healthcare and the disparities that we face and what Donald Trump is doing. I want to get into this video first because this actually sets up the story. So, talks about why Black doctors are so important. We're going to look at this, and then we shall get into the rest of the story on the other side.
Let's turn now to our health spotlight and welcome in Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. First of all, hello, how are you doing?
I am well. Good to see you.
Good as always to see you. Let's begin with a report yesterday. Only 6% of doctors in the United States are Black. The concern is that a lack of diversity in doctors can actually harm patient care. How big is that concern, and what does it mean for patients?
Well, the study just reaffirmed what we've long known, particularly for Black males. There are fewer going into medical school now than what there were in 1978. And this is not just an ethical, a moral issue. It really does impact patient care. Studies consistently show that people are taken better care of and are more responsive to their healthcare providers when they can relate to them. If you're someone who is differently abled, then that means someone who has a disability can relate to you better. If you're from a rural community, you relate better to a rural doctor. And if you're African American, studies consistently show that you have lower infant mortality rates, you have better outcomes, you're more likely to take advantage of treatments if you're being taken care of by an African American or Black doctor.
So how do we change that number? Is it college tuition help? I also know you've helped with the Black Men in White Coats, the organization that works to get young African Americans interested in medicine.
Well, we need more research into how we can improve the pipeline. Some of it is tuition assistance because, quite frankly, it's expensive to go to medical school. It's a daunting task, but that alone is not enough. You can't just give someone money and say, hey, you go for it. And I'm someone who's personally been fortunate to be able to be a part of pipeline programs where they provided me not only a scholarship, but also academic and social support when I was on campus. So there was the Meyerhoff Scholarship Program that I was in when I was an undergraduate. Eli Lilly gave me support when I was in medical school. We need holistic programs like that look not just at the financial need, but at the social supports and the academic help that sometimes people need to be successful to get them across the finish line. We also need to show them role models. You've got to see it to believe you can be it.
Sure. Okay.
So that's basically some of the basis of why it's so important to have, Black doctors, right? Especially in the Black community. Little story time. Last year, when I was trying to do my best to qualify for a kidney transplant, I remember going to the transplant office to go over numbers and what I need to do in order to be able to qualify for transplant. And so when I went there, mind you, 90% to 95% of all the doctors that I see are either white or Asian. That's the majority of the doctors that I see, right? The doctors are white or Asian. It could be Southeast Asian, it could be East Asian, what have you, right? Or sometimes maybe Arab. But that's the majority of doctors that I encounter. And so when I went there, they mentioned the doctor's name and they said, "Oh yeah, Dr. Watkins, he's really good." In my brain, I'm thinking that I'm going to be seeing either a white doctor or an Asian doctor. When I heard the last name Watkins, my ears perked up. I said, "Dr. Watkins. Sounds like a brother, right? Or sister, whichever." And then I go to the room. They say, "We're ready for you." I sit in the chair. Somebody comes in. It's a woman, white woman. I'm thinking, is this Dr. Watkins? She's like, "Oh no, I'm just a nurse. They're going to be taking your information." Okay, cool. She said, "Dr. Watkins will be in here shortly." I'm waiting. And as I'm waiting, the door opens up. You know, doctors, they always knock first and then they come in, right? He walks in. I look at him. He looks at me. I look back at him. He looks back at me. We look at each other. We're staring at each other in the eyes. A big smile comes across his face and a huge smile comes across my face. It was a black man. Dr. Anthony Watkins, black transplant surgeon, younger than me. Younger than me. Do you know how comforting that felt to see a familial face? To see somebody that looks like you who understands what you go through? Do you know? Some of you don't. And that's okay. But the thing is that it's kind of hard to explain, but it's almost kind of like it's like a more of a societal weight is kind of light. The load is kind of lightened because I have less to explain, and it feels like. And so he daps me up. He's like, "What's going on, man?" And he sits down. He's like, "What took you so long?" Because I've been on dialysis in May, it would have been 18 years. And I told him, my reasons for not getting it at the time. Really? And then he told me, he goes, "Look, in our community, there's a lot of distrust in the medical field." He's like, I get it. But things are getting a whole lot better, especially for us. And we need to, it's like, that's why I got into transplants. Because if they see me, they might be more likely to trust, medicine a little bit more, especially knowing that people like myself have an influence on how medicine is done. Because truth be told, those of us who are black, especially black Americans in this country, there is a major distrust in medicine because of a lot of the disparities and a lot of the things that were done to our community in the past. And these things are, distant memory, right? I talked about Henrietta Lacks, right? What happened with her. I talked about, the medical experiments that were done on black inmates. We've talked, many people have talked about ad nauseum about the Tuskegee experiments. We've talked about, we know about the father of gynecology, how he was experimenting on female slaves without anesthesia to study the female body. So we know. And then on top of that, We've seen and experienced where even in medical books and journals, where they would have racial disparities talking about how we feel pain less. So therefore, we are less susceptible to pain. So they're more willing to do more, things that are less sensitive. They're less likely to give us, pain blockers and pain meds in order to be able to do procedures. The studies that have been done, even just something innocuous like the pulse oximeter, right? How it's always been tested on white patients, but when it comes to Black patients, it's not tested on. So then when it comes to our outcomes, they either overcompensate or they undercompensate. And so it can lead to different issues. Even in dialysis, where they measured the GFR, the glomerular filtration rate for dialysis patients, and that they were more sensitive to white, Asian, and Latino patients than they were to Black patients, which means that we ended up on dialysis much more often. And I can guarantee you, go to the Orlando area, the Central Florida area, and you go to a dialysis center, and majority of the patients will be Black. And so all these different things come into play where we have a distrust of the medical system. Because of the disparities, because of white supremacy, because of racism, on top of the classism that happens. And so I'm saying all this to say that when we see somebody who is like us, there is a deeper sense of care to us because they know the struggle, right? Not saying that other doctors of other races or ethnicities aren't good or aren't effective, but there's an added layer of that comfortability. And you see what the doctor said, that trust factor also means that we're more likely to take the medications as prescribed. We're more likely to follow directions of the doctor a little bit more because we feel like they may be less likely to disregard us. And it's sad, but that's the way it is in this country. With that being said, there have been scholarships that have been created for us to have more Black doctors in this country. But the Trump administration does not like that because he thinks it should be merit-based. But here's the thing. If it was merit-based, then we wouldn't need a scholarship for Black doctors if it had been merit-based the entire time. But it's not. Let's get into the article. Because this is the thing a lot of people don't recognize. Some people, they don't see how this can affect us. But in reality, we need more Black doctors in this country. More Black doctors, more specialists, more nurses, RNs, LPNs, nurse practitioners. We need more. So this says, fearing reprisals, the University of Alabama, Birmingham cancels scholarship for Black medical students. Let's get into it. It says, as Alabama grapples with a persistent physician shortage, the University of Alabama at Birmingham has terminated a privately funded scholarship for high-performing Black medical students in response to threats from the Trump administration. I've said that 3 times because I don't want to hear some bullshit about merit. No. These are high-performing students that just so happen to be Black that, yes, it's specialized for them who are Black because we have an underrepresented population of Black medical professionals in this country because of white supremacy. Are you listening? And somebody like Donald Trump just doesn't get it. And the Black people that are around Donald Trump are going to kiss his ass and be like, well, yes, Mr. Trump, you're absolutely right. With their coon ass views, and then completely disregarding the same people that they were a part of. No wonder why some people be looking you up and down when you come to the cookout. Because just because you look like us doesn't mean you are part of us. Because you done left us a long time ago. You went up the ladder and you pulled the ladder up behind you. All the kiss whose ass? Whether it was Donald Trump or Joe Biden's ass, you guys were doing. Instead of saying, Mr. Trump, there is a disparity among Black people, among Black Americans. We need to make sure that they're good. They're one of the reasons why you were able to win. But instead, they didn't advise him. Let's continue. The Herschel Lee Hamilton MD Endowed Scholarship in Medicine was created in 2013 to provide medical school tuition to Black students who maintained a 3.0 GPA and demonstrated financial need. The Hamilton family and other private donors funded the annual scholarship. The recipients were selected by UAB. On February 14th, the Trump administration issued a Dear Colleague letter warning that under its interpretation of federal law, schools are prohibited from using race in decisions about scholarships, among other things. A month later, the Department of Education announced it was investigating UAB and 6 other universities for what it called impermissible race-based scholarships. So here's the thing. What Black people have went through historically in this country. All that was race-based, which depressed us and put us at the bottom, right? And so now you want to talk about merit while we're still at the bottom. You're not performing anything that provides equity to get us back to even. Remember, Black people are about 13% of the population, but only 6% of doctors are Black. 6%. That means 94% of physicians in the United States are not Black. 94%. Okay, so how do we make up that deficit? This is one of the reasons why scholarships like this exist in the first place. Because a deficit was created by white supremacy, and so therefore you're going to have to give equity to the disenfranchised people in order to bring us back to even. But Donald Trump doesn't want that. He's like, it should be based on merit. All right, well, if you want to base things on merit, then let's do merit then. How about all the money that was made up of endowments from Harvard, take those endowments away, find the legal means to take those endowments away, and give it to the descendants of the people whose descendants were enslaved by Harvard Medical School, by Harvard College. We're going to talk about merit, right? Let's do that. Let's take money away from the Jesuits. That's right, the Jesuit priests who enslaved Africans as well. And let's give that money to the descendants. Oh, you want to talk about merit, Donald Trump? Let's talk about reparations for freedmen. That's merit, right? Because the people who built this country, right? Are they reaping the actual benefits of this country? And please do not point to that itty bitty tiny little group of Black people who are the exception rather than the rule. No. We're talking about the base, the general majority of Black people. What are you doing for them when it comes to merit? You're allowing the children of the slaveholders to keep the wealth that they stole from my ancestors and to keep living and sitting pretty while our ancestors did all the work. And now we've inherited the debt. Is that merit? Is that real merit based? Oh, if we're going to do it, let's do it. Let's call it out. Because I'm going to tell you right now, everything that Donald Trump is doing when it comes to actual material conditions, he ain't doing much. 99% of everything he's doing is based on culture war. How is that actually helping you? On April 11th, UAB's Office of Advancement and Strategic Initiatives told donors that UAB has made a decision to discontinue awarding the scholarships and to return the scholarship funds to you. Citing Education Department's February letter, UAB said it had determined that the criteria for the scholarship could not be amended to comply with the law and the scholarship's intent. Supporters of the scholarship, including Dr. Hamilton's family, said the cancellation undermines much needed efforts to support Black medical students and betrays Dr. Hamilton's legacy. And so it talks about how Dr. Hamilton was a World War II veteran and how he helped the people who were harmed during the civil rights movement, the people who had dogs sicked on them, the people who had fire hoses put on them. That's who Dr. Hamilton was. And they named the scholarship after him. This one, under Alabama needs more Black doctors. It says the purpose of the scholarship was to honor and continue the advocacy my father promoted when he was alive. In a state like Alabama that has a disproportionately low number of African-American physicians, it is important to have more and more diverse physicians. Studies have shown that African-American people have better health outcomes when they are attended to by African-American physicians. Okay, so is RFK Jr. listening? He talks about make America healthy again. What about this? What about making sure there are more Black doctors in the Black community? What is he doing to amend that? I thought it was MAHA, right? Make America healthy again. So therefore, we are part of America. Our descendants built America. So therefore, why aren't you being more zealous about making sure that we're healthy? And I've said it before, and I'll say it again. Being Black American in this country is also in itself a class. So therefore, this is also classism. Because when you look at the disparities, including economic disparities, who is always at the bottom? So, wealth disparities, health disparities. Sounds to me like Donald Trump don't care about Black people. And don't get me wrong, Joe Biden and Kamala Harris didn't either. This is why we say to leave both parties. Every single Black person in this country needs to register as independent. I'm an independent. Why aren't you? Why are we continuing to allow our votes to go to people who say that they care about us, but in reality, when the rubber meets the road, they don't do a damn thing? And this is not a sexy subject. Look how many people are watching live right now. This is not a sexy subject, but it's an important one. Because the thing is, like, ultimately, when it comes to Black issues, it's not that important to some people. And that's the problem. Let's continue on. Recent research also shows that counties with more Black doctors have better health outcomes for Black residents and other marginalized by poverty. Researchers analyzed the data at discrete times points of 2009, 2014, and 2019 from 1,618 U.S. counties that had at least one Black primary care physician. They found that 10% increase in Black primary care doctors was associated with an extra month of life expectancy and lower mortality for Black patients. Despite these robust findings, more than half of U.S. counties did not have a single Black primary care physician. In Alabama, where about 26% of residents are Black, only 7% of doctors are Black. Here we go. In Alabama, 26% of the residents are Black, but only 7% of doctors are Black. That's almost 4 times less than the population. The war on Black people has not stopped when Donald Trump came in. The war on Black people has not stopped when we were under a Biden regime either. It continues, says the findings were strongest in counties with the highest rates of poverty. So it's also a class issue. Citing a Michigan study showing that Black physicians were more likely than doctors of any other racial group or ethnic group to accept new Medicaid patients. Dr. Monica Peak, position in JAMA Network, open that the researchers' findings may reflect that compared with non-Hispanic white doctors, Black physicians disproportionately care for patients who are uninsured and underinsured, exactly what Alabama needs as one of the 10 states that have refused to expand Medicaid. So therefore, they are the ones who are more likely to accept people who are underinsured or uninsured, meaning that it would help the people who are the poorest. These are the numbers, guys. And now making it so that doctors can't have scholarships, Black doctors can't have scholarships, specialized for them in order to increase the amount of Black doctors that we have. Well, many Alabama counties have no physicians and access to health care is extremely limited. The state consistently ranks in the bottom 5 states on indicators like infant mortality, overall child well-being, and life expectancy. The United Health Foundation, which conducts the longest running annual assessment of the nation's health, ranked Alabama 45th in its 2024 annual report. So this really just showing, how there's a denial of history when it comes to Black doctors, right? And why it would be good for us to increase that number. Under Denying History, it says, why would you end a program that focuses on the development and training of Black physicians who are more likely to set up practices in those communities that have the worst health outcomes? The UAB School of Medicine has really been committed to producing a merit-based, ethnically diverse crop of physicians. Adding that the medical school has been outstanding in its administration of the school scholarship program. The family thought that there was a way to maintain the program in accordance with state and federal laws, and they were disappointed that UAB instead decided to just pull the plug on scholarship. And so here's the thing, right? A lot of times people may say, well, they could just go for other scholarships. And the problem is that, number one, you're competing more with the general population, which means that your ability to get the scholarship might be less because it's going to be on a first come, first serve basis, and the money for that scholarship may run out because you're competing with the majority. Number one. Number two is there's still elements of white supremacy within the medical field. So how do you weed that out? Right? You have to weed it out by having more voices that can speak to the community, that can speak on behalf of the community. There was a nurse on TikTok that was talking about how they were labor and delivery, and one of the nurses was white, and she said she wanted to do a psych consult on one of her patients because she said she kept hitting herself in the head. The Black nurse, who was a nurse manager at the time, asked the white nurse, was her patient Black or African American? And she said, yeah. And she goes, was she wearing what it looked like to be a weave or sewing? And the white nurse didn't know if she was or not. So the Black nurse manager went, looked at the patient, talked to her, came back. She said, there's no need for a psych eval. All she's doing, her head itches and she has a weave in. And so she was patting her head to relieve the itching. That is something that is in the Black community, that's unique in the Black community. So therefore, there is no psych evaluation needed on that patient. But if the nurse manager was white and didn't understand that cultural significance, then a psych evaluation would have been done on that patient, and it would have been unnecessary. By the way, that psych evaluation would have also been added to the doctor bill for that patient. So this is why it's important as well to have Black physicians, more Black nurses, more Black doctors, and so on and so forth. How many Black women have complained that they had endometriosis or some other type of condition, and they had an OB that was either male or white, and they didn't really listen to them? And then next thing you know, they end up actually having the issues that they have. And it could have been relieved earlier on, but they weren't listened to. How many Black patients have complained about pain, and then somebody automatically thinks, oh, well, this person is just looking for drugs based on this? Because it happens. Why? I'm gonna tell you guys something. This is one of the reasons why whenever I have a surgery, I never finish my pain meds. I will always opt for the over-the-counter Tylenol, extra strength. You don't want to know why? Because I don't want people to think that I'm trying to get high off of these drugs. I still have a full bottle of opioids from my transplant surgery. Still do. It's just part and parcel of one of the biggest issues that we face as patients being Black in America. It's not just when we're riding down the street in our cars. It's also when we have to go to the doctor's offices. It's also when we have to go to the hospital. It's also when we have an emergency. That's part of the issue. And when people look at us and go, I don't see much of an issue going on, it's because they don't understand the things that we have to go through in this country just because of the color of our skin. And it's sad because that's ultimately every single time we have to get treated for something, we have to go through all these hoops. And then on top of that, a lot of the testing and things like that are race-based, which means that there may be something wrong, but doctors may disregard and say, oh, there's nothing wrong, when in reality, it's based on your race. So if you're white, if you have these numbers, oh, well, there's something concerning there. But if you're Black and you have these same numbers, well, it's not as concerning. So therefore, they may underdiagnose something that is actually wrong. And then once that underdiagnosis happens, and then when we wind up with some medical condition, whether it be pulmonary, whether it be renal, whether it be cardiac, then they're like, wait, how did this happen? Because you actually went by a race-based test. You went by standards that were race-based. Instead of actually doing it according to just general numbers of human beings. And that's part of the issue. So yeah, let's continue on with this because, and yes, if you guys sense, I feel very strongly about this because I've been dealing with the medical field for almost 20 years as a dialysis patient. I've been dealing with this. I'm still dealing with this as a transplant recipient. Now, thankfully, it's gotten better, but it's still an issue. Especially now since they're telling us, oh, well, we're going to stop the scholarships that may put more Black doctors in the area, especially since we're disproportionately doing worse economically in many different areas. So therefore, we need those scholarships. Let's continue on. It says the Department of Education's description of programs like this scholarship as discriminatory amounts to denying history. It's an indication that the Secretary of Education is not a student of U.S. history or race relations and the construct of race in the United States. She doesn't recognize that the disparities that exist are a result of historic practices, policies, and laws in generations past. These schools are trying to divorce themselves from these programs as if society self-corrects. It doesn't. America socially, as it relates to race or inclusion or health outcomes, has never self-corrected. corrected. You have to have intentional programs of inclusion in order to change the outcomes. Yes, because whenever the outcomes needed to be changed, it was never through, oh, well, this is wrong, we should just do it this way. No, we literally fought a war over it. We fought a war over it. We literally had people that were bitten by dogs, that were sprayed by water cannons, that were beat over the head by police, shot with rubber bullets, gassed by tear gas, in order to be able to move the needle forward on having actual equity and equality. So people, when we talk about having less racial disparities, when we need more Black doctors, people want to point and go, oh, well, you guys just need more of a merit-based system. It is a merit-based system. That's the problem. It is a merit-based system because you guys, I'm not talking about all y'all, but I'm talking about the system itself. Went against merit based on race by making sure that anybody who was white got a pass, but when it came to those of us who are Black, we didn't get a pass. And so this is why we have less doctors. And then on top of that, you factor in not just the race, but also the economics of it, how we're disproportionately economically more disadvantaged than any other group. And so therefore, medical school is extremely expensive. And then people look at me like I'm crazy whenever I say we should have tuition-free public school, including, in my opinion, up to a doctorate degree. I mean, if you want to make it merit-based, fine. If you want to make it universal, okay, fine. But if you don't, well, then you need to give us reparations and make sure that all the medical schools also give free medical school training to any Black person or any descendant of slaves that wants to study medicine. It's got to be one or the other. I'm fine with either one. Make it free across the board for all medical students, or give us reparations, and part of that reparations package, not only with cash reparations, but also making sure that we get tuition free at medical schools, at schools for law, technical education schools, and the like. Because ultimately, this country was never based on merit. It was never based on that. Who were the ones that were allowed to vote back then? Exactly. Was it based on merit? No. Never was. And so this is why this topic is so important. Because we're constantly being swept under the rug. Whether it's the issues that are brought to us by Democrats or Republicans, it's never actually solved by taking care of the underlying cause. Really, the underlying cause is capitalism. Because that means if you cause equity to happen, that means that it signals to all working people that, well, if they can get that to happen for them equitably, what can we do, as the working class collectively for ourselves? Because then you start to get rid of those disparities. So this is why I say this is the war on Black Americans. And the war on Black Americans is also a war on the working class. This is why we need to change the system. Because there's some sorry, can't talk today. Some equity needs to happen. Notice I didn't say equality, I said equity, because you need equity in order to have equality. In order to help us reach a position where we are equal. So don't stop trying to fight for a brand new system. Continue to have solidarity with people who are different than you. And make sure that we try to do what we can to build each other up. Because ultimately, we're going to save us, not these politicians who are basically the lackeys of the corporate dictators. It's going to be us that save the day for ourselves.